Palpation.
Palpation. Okay.
Edit.
Oops. I'm going to push that too far. All right. There we go. Just raising your bed so I don't have to bend my back so far. Great. Okay, your site looks wonderful. Does it have any burning? Everything's okay? Great. Okay, no problems at all with your IV site. Wonderful. Okay. Now, Mr. Johnson, do you know what this medication is for? Okay, it's for the infection that you have? Great.
Encourage client to report symptoms of discomfort at site. Verify medication. Third check.
Okay. Now, if you have any burning once I've started this medication, or if it feels cold at all, you see any swelling or anything like that, then please let me know right away. Just put on your light. Okay, so my medication is fine.
Administer infusion. Piggyback or tandem infusion. Connect infusion tubing to medication bag. Allow solution to fill tubing by opening regulator flow clamp.
Okay, hold on 1 second. Catch up with you. So the first thing you're going to do is always close your clamp. Okay. And you're going to make sure that you keep your hands sterile. Use a twisting motion. Okay. A little bit of fluid, about 1/3 of your drip chamber in, and then you can hang your bag, take off your cap, again, keep the hands sterile. That's interesting. It's going to come off one, so hold on. See if I have my hands next. I do. And my hands sterile. I'm going to purge through my line. Cover back up my end. All right. Ready?
Once tubing is full, close clamp and cap end of tubing.
Okay.
Hand piggyback medication bag above level of primary fluid bag. Use hook to lower main bag.
Okay, so you're going to take your primary set and you're going to lower it so that your secondary set will administer first. Okay?
Hang tandem infusion at same level as primary fluid bag. Connect tubing of piggyback or tandem infusion to appropriate connector on primary infusion line.
Now always think about how irritating that medication is. The more irritating it is, you want to back it up a little bit away from the site. So I'm not going to use the port that's closest to my client. I'm going to go back just a little bit. I'm going to give the port a good scrub. And then I'm going to, there's 3 ways you can connect your end piece. You can use, I think it says that next, 3 ways.
Stopcock, wipe off stopcock port with alcohol swab and connect tubing.
You can use a stopcock, which we're not using today. The second way is
Needleless system.
we had a needleless system, and I think you used the needleless system when we were doing blood.
Tubing port.
Okay, and then the third way.
Tubing port. Wipe off port, then connect sterile needle to end of piggyback or tandem infusion tubing. Remove cap, cleanse injection port on main IV line, and insert needle through center of port. Secure by taping connection.
Okay. Tape it, secure. I just used a needle. there's a needleless system. So it's taped in place. Okay?
Regulate flow rate of medication solution by adjusting regulator clamp. Infusion times vary. Refer to medication reference or institutional policy for safe flow rate.
So if this was this is a 50 milliliter bag, and you wanted it to infuse in 30 minutes, you would do your calculations, and then you set your drip rate. And you will be given a calculation for your checkoff. And then you will count your drops. Make sure you have your watch. Okay? All right?
After medication has infused, check flow regulator on primary infusion.
So once all of your secondary line infuses, your primary line will start back automatically. Okay? So that'll be an automatic. But you do want to come back later when you know it's done. If it was only to go in 30 minutes, you want to come back in 30, 35 minutes and then put your primary back up on your pole. And then you can just leave this there. You don't have to take down your tubing every time. It depends on your policy of your facility or the hospital. A lot of them leave it in place, and all they replace is the bag, especially if someone is getting a antibiotic or an infusion or piggyback every 4 hours. Then there's no need of throwing this tubing away. All they do is change the bag. Okay?
Volume control administration set.
Okay, so a second way, so this was by a piggyback. A second way that you can deliver a medication is you can add in the amount of volume that you need here in your Volutrol. So let's say I'm going to deliver this in 50. The doctor wants it in 50 mLs. Okay. I was squeezing, put 50 in here. Okay. Go ahead.
Fill Volutrol with desired amount of fluid, 50 to 100 milliliters, by opening clamp between Volutrol and main IV bag.
Clamp here.
Close clamp and check to be sure clamp on air vent of Volutrol chamber is open.
Okay.
Clean injection port on top of Volutrol with antiseptic swab.
I would clean here.
Remove needle cap or sheath and insert syringe needle through port, then inject medication.
And I will put my medication directly in here, and it will be in this amount of fluid. All right?
Gently rotate Volutrol between hands. Regulate IV infusion rate to allow medication to infuse in time recommended by institutional policy, a pharmacist, or a medication reference manual.
Okay, so I will regulate my drip here. A little bit harder to regulate. Okay. If it's not set on the pump, I would count my drips, okay?
Label Volutrol with name of medication, dosage, total time including diluent, and time of administration.
Okay, so if you're not using a secondary bag, then you have to label this Volutrol so everybody knows it's medication in here. Because they're going to be expecting whatever you have in the bag to be here. But if you've added something to this, that you need to put a label here and make it nice and big so that they'll recognize that there's medication here, and I shouldn't add anything else to it until all this fluid is gone, because that's where the medication is. Okay?
Dispose of uncapped needle or needle enclosed in safety shield and syringe in proper container.
Okay. You'll put it in your biohazard container and then get rid of all of your items.
Discard supplies in appropriate container and perform hand hygiene.
All right, Mr. Johnson, you're all good to go? Okay, please let me know. Put on your light. If you have any burning, any irritation, even if the arm feels cool at all, we want to make sure it's not infusing into the tissues. And so just let me know. Put on your light so we can come right in and check that right away for you. I'm going to lower you back down.
Mini infusion administration. You'll need to review your textbook for this.
Your mini infusion, the book gives really nice pictures of different type of pumps that we actually don't have available in the lab, so please make sure you review those. You will not be checked off on those, but it may come up on your exam, so please make sure you're familiar.
Ask client to explain purpose and side effects of medication.
Okay, so remember your medication and what it was for? Absolutely, your infection that you have on your leg. Okay, and any side effect? Good. It may cause itching, it may cause chills, it may cause whatever. Right, absolutely.
Record medication, dose, route, and time administered on MAR or computer printout.
Okay, I will be back in about 30 minutes. That'll be all gone, and then I'll be back in and check you. Put on your light if you have any problems. Alrighty, have a good one.
Record volume of fluid and medication bag or Volutrol on intake and output form. Report any adverse reactions to client's healthcare provider.